These are my disclosures, and I do receive compensation for the G7 cup, which is included in this presentation. So we know that the fundamental limitation to longevity and total hip replacement remains failure of the bearing, and this is very much related to wear rates and subsequent causing of osteolysis, especially with the older polys. And so there are two strategies which have been implemented to try and improve the wear characteristics of the bearing, and these include altering the polyethylene itself by improving its wear resistance or negating the use of the polyethylene altogether. And my talk today is on what measures have been taken to improve the polyethylenes in recent years. So the first strategy that was undertaken many years ago was to try and improve the wear resistance of the polyethylene by cross-linking the molecules. And they did this by gamma irradiating the polyethylene, which would form cross-linking between the molecules and improve their shear resistance. And this did lead to decreased wear, but unfortunately it came with new problems, because one of the byproducts of this irradiation process was that it led to the elaboration of free radicals within the polyethylene, which then made it vulnerable to oxidation, which changed the mechanical properties of the polyethylene itself. And so we started to see increased brittleness, fatigue failure, and catastrophic failures, especially with the thin crossing polyethylenes at the rim of the cup. So to try and deal with the free radicals, there were two processes implemented. The first was to heat the polyethylene above its melting temperature. And what this did, this process was very good at getting rid of the free radicals, but again what it did do was to reduce the crystallinity of the molecules themselves and thus reduce the mechanical strength. So you kept the wear resistance improvements, you improved the oxidation resistance, but you compromised on the mechanical strength side. So as an alternative was to heat the polyethylene below melting temperature. Here again, you kept your wear benefits, you maintained your mechanical strength, but the process was nowhere near as good as heating above melting temperature in getting rid of the free radicals, and so the polyethylene remained somewhat vulnerable to oxidation once it was implanted or removed. So then, if the ideal then polyethylene is one that has good wear properties, has resistance to oxidation, but at the same time maintaining its mechanical strength, and both post-irradiation processes of annealing and melting seem to come with intrinsic deficiencies in achieving these aims. And so what has been tried lately is the introduction of vitamin E into the poly to try and deal with this problem. So what does the vitamin E do? The vitamin E basically quenches the polyethylene of the free radicals. So after the irradiation process, the vitamin E is infused, and this then negates the necessity for trying to rid the free radicals from the polyethylene by heating it. So you no longer have to heat the polyethylene to deal with the free radicals. And how does it do that? It actually, the vitamin E molecule binds the free radicals, thus not making them available to the oxidation process once it's implanted or removed from its vacuum seal. So the free radicals are still present within the polyethylene, you haven't got rid of them, they're just no longer available for the oxidation process. But the advantage is then you no longer have to heat the polyethylene, which compromises its mechanical strength, and so you maintain the mechanical properties and the wear resistance over time. So this is the process of the vitamin E poly manufacturing, and I can't seem to get the pointer to work. So you start with your normal polyethylene, it's gamma irradiated, then infused with the vitamin E, and then you no longer have to heat it to get rid of those free radicals during the sterilization. And there are two processes of how you add the vitamin E. You can either add it by diffusion, which means after the cross-linking process, or you can blend the vitamin E with the polyethylene prior to the radiation cross-linking. I happen to use the Biomet E-Poly just because that's what was available to from the start, and I guess as a result of that I'm somewhat Biomet brainwashed, and so I use the diffusion type, which is what they have. But the theoretical advantage of diffusion over blending is that if you add the vitamin E to the poly prior to irradiation, it does seem to inhibit or make the cross-linking process a little bit less efficient. And so for the same radiation dose, you don't seem to get as high a cross-linking density. Now, whether this makes any clinical difference is yet to be ascertained, but that is one of the theoretical advantages of diffusion over blending. And there's no doubt that simulator studies show that vitamin E poly has very good wear characteristics. We're approaching wear rates close to hard-on-hard bearings, and certainly seems to be better than even some other second-generation cross-link polys. Whilst at the same time we maintain its mechanical properties, it has much better tensile strength than the melted polyethylene, and similar sort of yield strengths to your annealed poly. So we're again maintaining the mechanical properties of non-heated polyethylene. So has there been any clinical studies? Has there been any clinical benefits for our patients? What do the clinical studies show? Well, we're still very much in our preliminary phases of clinical follow-up. There are 2 or 3 studies now out to 5 years. It does appear that the results are fairly promising. It appears to be safe with good clinical patient outcomes reported and no catastrophic failures so far, but still only early days at 5 years. Both studies have done RSA wear rates, and the head penetration rates are similar, if not perhaps a little better than conventional cross-link polyethylene, which is pleasing. And even more pleasing, it appears that the head penetration rate per year is below that osteolysis threshold described by Eng of 0.1 millimetre per year. So out to 5 years, we do appear to have fairly promising results, but still very preliminary. And one of the major advantages, I think, of polyethylene over the harder bearings, especially if we can produce a polyethylene that has wear characteristics similar to the hard-on-hard bearings, is that you do have more options. And whilst I use a neutral line in the vast majority of my patients, it's nice to have these backup polys in the situations where you may not be able to place the acetabular component in the ideal position that you'd like to because of bone deficiency or bone deformity. So in conclusion, is E-poly the polyethylene of the future? Well, I think E-poly is a promising prospect. It seems to give us the right balance of superior wear performance whilst maintaining good mechanical strength, as well as giving resistance to oxidation. Is it the poly of the future? I think that question is yet to be answered, or will be answered in future studies, but I certainly have enough confidence in it now that I do use it as my routine bearing in total hip replacement. Thank you very much.